Welcome again to Call the Mayor Wichita. I'm Craig Andrus, your host. We're glad you're with us. We know that a lot of you have questions, so we're here to answer those questions. And along joining me, Mayor, Mr. Whipple, thank you for being here.
Thanks for having me, Craig. It's great to be on our show again, and looking forward to answering questions from the public.
Well, as always, that's why we're here. That's the show, Call the Mayor. So call the Mayor. 316-491-5787 is our number, 316-491-5787. Mayor, I know that we've talked about reopening. We are reopening in the process. Let's kick it off with that.
Yeah, I actually brought some notes to make sure that I didn't mess up these dates because, for the city of Wichita, we are actually, or at the city level, we are doing a phased-in approach still when it comes to opening up our city facilities to the public. And I want to make it crystal clear that I'm not talking about private businesses. They are now able really to, with the governor lifting her order, really to use their own discretion. But when it comes to stuff like libraries and golf courses and the stuff that I think the public expects out of our city, we actually are doing a phased-in approach to make sure that we keep our people healthy while also delivering services. So I actually have a list, and hopefully people can call in and I can expand on this. But right now, our library has been one that a lot of people have reached out about. We have pretty much a curbside service, I guess you can call it, where if you order your books or whatever items, you put it on hold, you'll get an email and be able to show up when your stuff is ready and they'll walk it out to your car. And they're also going to have other types of services as we slowly reopen, where you can go in for limited services such as using the fax machine, utilizing the computers, stuff like that. And we're asking people to take precautions, of course, to make sure that you are using, wearing a face mask, wearing or having hand sanitizer, really doing the stuff that Wichitans have been doing that's been keeping our city safe and relatively ahead of the coronavirus when you compare us to our neighboring cities, our comparable cities.
All right, some of those cities, of course, are going to be like the Tulsa and even the Overland Parks, which is attached to a bigger, larger metro area. But for us, we have opened up, library. You get the curbside services. I know that we've got the Riverside Tennis Center. That's coming June 1st, so that's just right around the corner. 316-491-5787. You can ask the mayor anything you'd like, and I know, Mayor, you've been in touch with county leaders on this day. Tell me how the talks have been there.
Really, at the county level, they are the Board of Health, okay? So for our system of local government, a lot of, I think, the questions and the concerns come to the mayor because a lot of people think, well, the mayor's in charge of Wichita. However, we fall, when it comes to a health crisis, our local form of government makes Wichita fall under the county commissioners. So usually what I'm doing is forwarding that information, those concerns on to our county leadership. And they had a meeting where they are, at this point, I think leaving it to the discretion of businesses as far as reopening, which really places, I think, that responsibility on individuals. So we are asking people to, just make sure that at this point everyone knows that the coronavirus is here, it's in our community, and how to stay safe. Utilize these best practices. Make sure that we aren't putting people who are in a high-risk category at continued risk. Keep looking out for your neighbors and do what you can to stay healthy. So, we're just trying to get through this, I think, like every other city is, but we're doing so really well at this point. We have countywide, I think, 21 deaths right now, which is still really bad. We obviously don't want anyone to die, but when we look at the modeling that was coming in at the very beginning of the coronavirus outbreak, we were looking at projections of 200 to 300 deaths if we didn't do anything at all, or if we acted too late. So Wichita has really done well, and so is Sedgwick County, getting ahead of this, and we want to make sure that people continue to do that.
I know, being in leadership right now can be a stressful time, county or city. Gene, you are on the show. Call the mayor. What is your question for the mayor?
Hi, Gene.
Yeah, Mayor, how do you like your job so far this first 6 months?
That's a good question. I'll tell you, my first 6 months I thought were going to be a little different than they have been. My goal was to pass transparency policy and open up different types of opportunities for small businesses. And that very first week I was sworn in, we got hit with the layoffs over at Spirit. We got hit with this economic crisis. And then as soon as I think we kind of got a grip on that crisis, we saw the coronavirus, this international pandemic, where there's no blueprint for it, right? Like this is something that in America we haven't dealt with this for about 100 years. So we're getting through that as well. That obviously decimated our economy as well. So it's like a national or a natural disaster really is we need to first, in my opinion, keep everyone safe, save as many lives as we can, and I think we've done a really good job with that. And then the next is rebuilding, making sure that Wichita bounces back better than ever, and I think we will. We just have that type of community where we have the resources, and we really have that fighting spirit where we're going to get back to where we were. But I'll tell you, we had a really great summer planned. I was bringing back the public State of the Cities. We were gonna have a big party to celebrate Wichita and our city at our State of the City. We had park openings. We had the St. Patrick's Day Parade. We had Riverfest lined up. We had Wichita's 150th birthday lined up. Really just some great events that were supposed to take place this year. And of course, the health of our community comes first. So a lot of those events went to the wayside as we battled against this pandemic. So coming in, I was thinking we were going to be doing a lot more of that scheduled stuff, and instead here we are. But like I said, we're doing better than I think a lot of other comparable cities, and I feel pretty battle tested, to be quite honest. And I read online we have murder hornets now in America, and I kind of joke, we're like, well, that'll probably be month 6 I have to deal with the murder hornets, or aliens landing in Old Town, and now we're going to have to fight them off with 6-foot spears so we can socially distance while we do it. So, we joke around about what's next, what's the next big thing, but we're pretty serious at confronting these things head on and making sure that, Wichita is in the best position possible moving forward.
Well, it is a challenging time, and I know that from a health perspective, most all of us have heard about somebody who has this, somebody who's gone through it, perhaps even somebody who's died because we have had some deaths. A lot of people anxious or excited or even nervous to get their businesses back going again. 316-491-5787, that's the number. With that in mind, we got a question on Facebook here, and you can catch us on Facebook, we hope you do. Lonnie has this question: Mayor, do you support more flexibility in our incentives to support small business?
Yeah, definitely. Is this thing? Sorry, the camera guy just told me to fix my earpiece, and he did it so no one noticed, and of course I just mentioned it out loud. So okay. I'm getting used to this live television stuff.
But the flexibility side of things, I think is the basis for this question. Would you support more flexibility in our incentives to open up small business? Small business, as we know, really the backbone. We love to have the spirits around in those large employers, even the hospitals. But the question is flexibility incentives for small businesses.
Definitely. And that's something we got to look at when it comes to rebuilding our economy. I mean, the only good thing about such a devastating situation that we're in is this is usually the time where elected leaders look towards change, right? Where we have to rebuild stuff, and we have to look at really a hard look at what worked and what didn't work in the past. And I truly believe that for Wichita to get to the economic levels that used to be back in the 80s, we need to invest in people who already have their roots here in Wichita, which is our small business community. We are starting the conversations for economic development right now. We have, I think, about 1.7 million allocated for economic development, and during those talks, we actually look at this data and Loney is actually someone who follows this, so I think he knows this. We look at the data that shows these kind of squiggly lines from the Great Recession to where cities are now, and every city is beating us in economic development that we're comparable to on that chart. And when you ask, well, why is this? What's going on? It usually has to do with diversity, with diversifying our economy, pretty much not putting all your eggs in one basket, which for us is the aviation sector. So it's not about just attracting more jobs to Wichita, but also utilizing what we do really well in Wichita, which is entrepreneurship. So if we want to diversify, we have some businesses here in Wichita that if they had access to the type of incentives that they would in other cities could actually grow their footprint, which automatically diversifies us because not all those businesses are in the aviation sector. So yes, for Wichita to get back to where it was in the 80s, when our job growth rate was twice that the national average, I think that we need to definitely invest in small businesses that are already here so that we don't have to spend that money attracting some of these bigger businesses, but also growing those businesses like we have in the past, like we've done with Pizza Hut, like we've done with some of these other world-known brands now. So I think that there's a lot to that conversation, and it's one we're having at the city level.
Well, Mayor, I guess that's a good jumping off point for my next question. This one came to me on Facebook. Give us a call, 316-491-5787. You can ask any question you'd like. 316-491-5787 with the mayor. And the question came to me, and it has exactly to do with what you were just mentioning, so this is a good jumping off point. The question is, what specifically are we doing to diversify? We've seen so many layoffs. I didn't say so many, but we've seen layoffs at Spirit. We've seen problems with Boeing, which is still working closely with Spirit. What is being done specifically to get the economy diversified? So I will point that to you for this next question.
So first off, we got to start with having the right conversations, and that happens in our with the council. It happens in our we call them summits. They kind of feel like hearings. If you were back in the legislature, it's a time when we start looking at what our options are and what people, the experts say, I guess, as far as what we could be doing to grow into jobs that we have here in Wichita. The next thing we got to do is talk to our small business leaders. Right now, one of the things that I just formed is the Mayor's Council on Small Business, and it's a council that I get to refresh membership about every quarter. So every 3 months, appoint new people to it. And we actually have a meeting tomorrow at 9 a.m. For those of you who like to follow, we're going to stream it live on YouTube. And it's pretty much getting your thumb on the pulse of the business community and the small business community here in Wichita who might not be involved in some of these types of I guess organizations that have the ear of the city council or of the elected officials. So I think that we have to bring people to the table and ask them really, what do you need to grow? And be looking towards not just what we have been doing, but what do we do really well? So in Wichita, we can build anything. So that doesn't mean we have to just focus on aviation. In this, I said, when we get into these situations of tragedy, we actually, I think, take more risk, and we're seeing different business models, or GM, for instance, who switched over to building respirators. So we know that you might have a company that does really good manufacturing this one item, but that craftsmanship, that type of efforts can be utilized to manufacture other items as well. So I think that moving forward, we have to build on what we already do really well. Manufacturing is one of them. And also we have to start thinking about that next economy, which is going to be technology. Wichita, we not only want to put airplane parts into the national economy, or not the national, the international economy, but also we can do the same thing with digital products. We have to realize that tech is the future and put some of these products up into the cloud so that we can sell them internationally to different markets throughout the globe. And we have companies in Wichita that are actually doing that. Quick is a good example. They have a product that they sell that is for, it converts video. If you're have a video on social media, it actually does all of the captions for you. So it's a marketing software. And last time I talked to them, first time I talked to them, they were in 70 different countries, and right now they're in over 100 different countries. And I talked to the owner right when the coronavirus was really becoming well known, and he told me his product is being utilized quite a bit now. And I responded, you're probably saving lives. Like your product here in Wichita is probably being utilized to get this information out to people so that they're better prepared for taking precautions for the coronavirus. So I want to utilize small businesses like that and try to figure out, okay, what can we do to create more opportunity for entrepreneurs, like the people who run Quick.
Well, and indeed, it didn't take Textron, it didn't take them long at all to kind of ramp up, and it's a volunteer/combo effort over Textron. Started making masks and started, mobilizing some resources. Didn't take them long at all. 316-491-5787. That is the number to call the mayor, Wichita. Brandon Whipple here to answer your questions. David, you have a question for the mayor. Didn't get the specifics on your question, David, but you're on the show. Welcome.
Hello.
Hey, David.
Oh, okay. So my question today is, do you think that we could or should give Wichita more autonomy as opposed to the county?
Give us more economy, is that what we said? I'm sorry, I missed that.
Do you think we should give Wichita more autonomy as opposed to the county?
David, let me drill. Oh, autonomy,
Autonomy,
more
is that what it
autonomy
is?
compared between the two. Well, good question, Mayor.
Okay, I thought you said economy. I was going to say we really overlap with economic goals. Well, really, there's supposed to be a balance, and I think that I kind of just crash into local government coming from the legislature. So usually, the last few mayors have actually come from the local level and already knew the players at the city level and at the county level and work really well with those relationships. I'm fortunate over at the county level where they have been, really because we've been going through this crisis, we've had to fast track those relationships. So really, I appreciate the balance. I appreciate how we have been working together. And although we disagree at times, I know that I've had disagreements with members of the county, and they've had disagreements with me. Usually we talk it through and we talk it out because we all share the same goal of furthering the economy and creating more prosperity for the people of Wichita and our surrounding communities. So yeah, I really don't want to weigh in on if we should have more here or more there. I think that overall you're supposed to have a bit of a balance, and I think that my job and really their job too is to talk about what that balance is, to talk about, this is over in the county's lane, this is over in the city's lane, so that people know how to best get their needs met, but also who to hold accountable if something's going on that they don't appreciate. So I think this crisis has taught us the differences and really showed, I think some of that divide between city powers and authority and county powers and authority, and I think it's something we might revisit at the end of this as well. So, but overall, we need to have balance, we need to have harmony, and I think some of the politics get in the way of that, but in the end, we all have the same goal of furthering our area, both economically and with opportunity.
All right, 316-491-5787. That's your number to call the mayor of Wichita. We got a Facebook question here. Next question up, does the city have a whistleblower line? Good question. Mayor?
That's a really good question. So I would have to double check because I get a lot of emails from people who, are worried about a service that the city is performing, and usually I'm able to forward those on, to the right departments. However, the way our system is set up at the local government level is you really have kind of these two branches where the administrative level falls under the authority of the city manager, and the city manager is the only employee who reports to the city council. So the whistleblower laws that I think you might be looking for probably fall under the administrative side of our government, which the elected officials don't really cross that lane very often. We're actually bound not to by our city ordinances, which is it's good and it's bad. The bad part is if you told me a whistleblowing story that something's happening, I have to, there's not much I can do. I have to report that and hope that they take care of it. But also the good thing is we have a very professional staff that runs City Hall and not just, political appointees. They're actually people who have earned their spots to the merit system. So as far as the whistleblower policy, I know that once we get into the ethics debates, one of my goals is to create ethics reform here in Wichita. It's something I campaigned on. It's something I think a lot of people are looking forward to. In the draft proposal that I have written up, it has a whistleblower policy in there because I think a whistleblower policy is very important. But as far as your question, I think that that'd be better, something to research over the administrative side to see if there is a overall whistleblower policy or if it's if each department has kind of their own process.
All right, 316-491-5787. Thank you, Mayor. Next question comes from Darwin. Darwin, you're on the show. You got a question about PPE. What is your question?
Welcome.
Thank you. There's a premier seamstress and tailor shop in Wichita that has been on the news that has sewed thousands of masks and gowns for local hospitals and McConnell Air Force Base and individuals. And even early on, they were donating them and then fulfilling orders. Why did you outsource masks and PPE supplies to businesses outside of Wichita? And why did you not support our local businesses in Wichita that have those capabilities?
Outsourcing. Okay, Mayor.
I definitely never outsourced local masks or looked outside Wichita for our products. I'm not sure who did. It might have been on a county level. They were actually the ones who were looking who had the stockpile of PPE. In fact, I actually early on organized with a volunteer named Kenzie a website called ICT Response to create a resource for local businesses to not only put up PPE, not only put up, we see breweries who have now created hand sanitizer, to put up the stuff that falls under the category of PPE, but also to ensure that our local businesses, while they were not able to receive customers, could still sell gift certificates. I'm a huge supporter of the Wichita economy, and would never under a action under the city council or under the mayor look outside Wichita if it was a need that we can actually fulfill within Wichita. And for the past, I think, 7 years when I was a legislator, I supported the Buy Kansas Act, which ensured that local communities in our state utilize our tax dollars in our local economies because tax money that's spent in our local economy actually has a multiplier effect and adds to our economy. But I do want to also mention that the Chamber of Commerce, Wichita's Chamber of Commerce, has actually created a really great website that lists all the PPE, all the hand sanitizer, all these type of products that are made right here in Wichita. And I think it's going to be really important for people as they open up and they want to provide their customers with masks or hand sanitizer, because you really don't know what you're going to get when you order online, right? Like, so if you order something from Amazon, you might get one product might come in a little different than what it's advertised as. When you order that stuff here in Wichita, you know what you're going to get. You know that the product was made with quality, with high quality, and you also know if not, you can return it. So please check out either ictresponse.com or go to the Wichita Chamber's website, and they will also have a list of, particularly with PPE, all the local businesses that are creating that.
Okay, very good. Thank you, Mayor. 316-491-5787. That's a number. Ask a question of the mayor, any question you'd like. Mayor, I did want to go over, we can take a look at this, but let's go ahead and show that full screen again. I wanted to talk about the openings here now. We've got the reopening of the city facilities right now. You've got all golf courses, as well as City Hall. I know City Hall is open, the county building is open as well. Municipal Court, they've started back again, and you talked a little bit about the libraries, except for the Linwood branch. I don't know that we mentioned that, but June 1st, we got quite a few things coming up. I talked about the Riverside Tennis Center. Is that, oh yeah, that's on the list, okay. The rec centers, Linwood branch of the library does open June 1st, but playgrounds and parks. Are we handling those all the same, or are there going to be some different ways that these facilities are open, or are they all under kind of one mandate? This is how Cowtown's going to open, this is how Century 2 is going to open, this is how the Keeper fire pots are going to be relit, which is always very cool, so it's glad to see that. But do we know, Mayor, if these things are all going to be a little different, or if there'll be social distancing guidelines for each specific one?
So there will be a kind of overarching theme, I guess, of similarities. For example, wearing masks. We're going to ask everybody in any indoor facility, if you're around people, if you have that, if you're able to or likely to become within 6 feet of someone, to wear a mask. So that's going to be just everywhere is going to have that similarity. And over at City Hall, we actually have different markers on the ground to let you know if you're waiting in line, if you're 6 feet away from the person in front of you. And not only do we encourage masks, but we'll give you a mask if you come in and you don't have one. So I think the indoor stuff is going to seem relatively the same, but our real focus is on safety. Not is something essential or is something in high demand, but is it safe? And we are talking with our staff and our department heads to figure out, okay, well, what is the safest way to do this or to do that? For example, golf is something that I think was always excluded on the governor's list as far as businesses that could continue during her stay in orders. But here in Wichita, we actually closed down a lot of the golf courses and slowly started opening them up once the department head said, hey, we can do this in a safe manner by eliminating some of those common touch areas. And that's going to be important moving forward. It's not just wearing a mask, it's not just not shaking hands or using hand sanitizer. A lot of it also is making sure those common touch areas where where people might actually pick up the coronavirus from the person who touched it before they got there. That's what we want to prevent. And so we're going to see some differences, particularly when it comes to, let's say, kid areas. I'm a dad. I got a 6-year-old, a 5-year-old, and a 2-year-old, and I can't get them to. And by the way, they're gross. Like, they're absolutely sticky hands everywhere. I get hugs before I go to work, so I got to go to work with like boogers all over my suit, and it's awful. But they're not unique. Kids are like that. So the common touch areas in the library, let's say the kids section, the kids section in the advanced learning library, it's designed for interaction. It's designed for touching. So it's likely that that is not going to open up when other parts of the library opens up, because we don't want we don't want these common touch areas to possibly spread this virus to a child who might even spread it on to their grandparents or their parents. So the point is that we're not looking at this as what's the demand or what is what are we getting the most emails on. We're looking at this, what is the safest way to move forward. Our number one goal is public safety and ensuring that we are being responsible by delivering services or a version of these services, like with the libraries with curbside pickup, for example, while still keeping the public as safe and healthy as possible.
Well, I've got a dovetail question here on the show, 316-491-5787. Give us a call, ask any question you'd like. I know we're getting a lot of COVID questions. We're going to get some of the reopening questions too, but this dovetails well with what you were talking about a little bit, and I've had people ask me this question. Masks. So Jane, if you're still there, you're on the show. Jane, welcome.
Hi,
What
Jane.
is your question?
Yes, we're needing some masks for our family, and I've thought about going online, and I could, online you don't know who you're buying them from or even if they're sick. And I looked around town in several different stores trying to find masks, the cloth type masks, and haven't been able to find them. If you know the names of these people that you were talking about that were making them, if they want to donate, they can donate, and we can do a fundraiser or put their names out there so people can call them and order direct. I just think it would be a good thing to help a lot of citizens out, because I see way too many people, the majority of people that on my side of town are not even wearing masks, and maybe it's because they haven't been able to find them.
Of course. No, you're hitting on a good point. Masks are something where we didn't think about just I think a couple months ago. So where do you buy a mask? We do have really good people in Wichita who, while they're home and being socially distanced, they're making their own masks, and some of them are able to give these out to other people. But if you're not fortunate enough to, I think, kind of be in that type of circle, where do you buy these masks? Again, I would really encourage people to go to the Wichita Chamber's website. It will pop up where a graphic where it will talk about local small businesses and PPE. Click on that. You should get a list at that point that will have areas in town, locally made cloth masks, places that you can purchase these masks at. And a lot of times I think you can shoot them an email and possibly even get them mailed to you, so that if you're someone who is still social distancing, or if you're of a high risk category, you won't have to go on out there and put yourself at risk. A very good point about you really don't know what you're getting when you order online. I think it was one of the doctors at the state level mentioned, and this was actually in a conference call, that some of the masks that the state has been offered to buy in bulk, he said, and this is his quote, I wouldn't use them as coffee filters. So you really don't know. You're going to have this international market where people are selling masks right now, but you're not really, I don't think we really know what we're buying if we buy it online. But if you buy it local, then not only can you go and you can check it out, but also if it's not what you expected, you can likely return it. So ICTresponse.com has lots of different businesses there, but also the Wichita Chamber's website. I'm not exactly sure off the top of my head what that website is, but I'm sure if you Googled Wichita Chamber, it's going to pop right up. And if for some reason it doesn't, shoot me an email and I'll respond back to you tomorrow. My email is just bwhipple@wichita.gov, and I'll be happy to send you not only that link, but other links as well. And that goes for anyone who's watching, by the way. If you want to know if something I'm saying, you want to do a follow-up, or okay, what was that link, or you mentioned this resource, just shoot me an email and I'll be happy to follow up with you tomorrow.
Okay, 316-491-5787. We got a couple of Facebook questions, but please call in. We'd love to have your calls. We do have another caller. Bernie, you are on the show. Welcome, Bernie. What's your question?
Hi, Bernie.
Yes, I'd like to have the mayor just summarize how we're coming on the new water plant. In other words, are we within the cost estimates? When will they expect completion? And where does most of the water come from? Do we,
Well, Bernie, I know that we are progressing on a water plant, and we are doing well as far as our budget. We're actually under budget, I think, and a lot of that water plant decisions went on hold when we entered this crisis with COVID. But the last time I knew, by doing a design build process, I believe we're about 13 million, possibly 17 million under budget. I have to double check that number. But what we're able to do is, acquire. We could build it this way, but if we were able to, talk to this business and utilize some of their land, then we could build it this way. We save money. I know we've had some legislation that has come across the city council that has made these adjustments recently that has been resulting in a savings for us. So my understanding is it's moving forward. It is on schedule, and we are under budget. And with any luck, we will have a world-class water plant in the near future to supply our needs for the next 100 years.
Well, thank you for the call, Bernie. I know part of your question too was the finance side of it too, and I understand that's been in the news before. Where do we stand on financing with getting it financed right now as a part of Bernie's question? I'm assuming that was part of what you were asking, Bernie. Yeah.
So we did get. It was a loan from the federal government. I think it was a couple of months where we were on the show, and I think we talked about it. I actually had all the details then, and I've just been really focusing mostly on the coronavirus and the economy lately. So I can't really cite you specifics with the numbers, but I know that we got a loan from the federal government that saved us a lot of money, and that is where, and we have to pay it back over time. But that's where I think the biggest news is actually. You're right, Craig. Craig just drank his water. I think it's got to fall over.
Sorry, apologies. Water, and then I got it down the wrong windpipe. I'm fine. Just
anyways, but we're moving forward on it. I can get you some details if you shoot me an email. But at this point, things are going as planned, and as far as the financing, we did have, and like I said, I think we reported on the show a few shows back, right after I got back from DC. We went to Washington DC, and we actually met with some of the department heads and who we were applying for these grants and these loans and so on, and making contact with some of the people in DC, and a lot of that paid off, and we were able to save a lot of money with public financing because of that.
All right. If you work with Public Works, Alan King or anybody?
Yeah, go ahead and call in. Maybe you can help me out.
Yeah. Tell us about those WIFIA loans and the amounts of those WIFIA loans. So call in, 316-491-5787 is the number. Give us a call. Bernie, hope that answered your question thoroughly. Appreciate you, and please don't choke on the water like I just did.
Yeah, so the water's dangerous here, but speaking of water.
Yeah, it's okay. Hey, listen, we did have a couple of Facebook questions too, and one of those was, and I think that we kind of touched on this. You'd mentioned this, but I think they wanted a more thorough answer. The first one was, is the city falling short on revenue? Do you anticipate any layoffs with the city, and where do we stand on the furloughs? Might be another portion of that question right now, Mayor.
Right. So we are projecting a $12 million $12 million shortfall this year, and then $16 million next year with our current budget projections right now because of this virus. And that means that we're not getting the same income as we normally do from the programs that we utilize, and also, our tax base is going to be down. Our fees are. People aren't as active in the economy as they would be if we weren't doing stay-in orders and doing social distancing. That has a real effect on our budget here at the city level, and I want to say we don't have any real easy choices. If you watched our budget retreat on Tuesday, which is on a YouTube channel for those of you who want to go back and check it out, they put up a list and it was tiered where we had tier 0, for some reason they started for 0, 1 and 2, and it was pretty much the stuff that we can shift money from here to there and not see much change in delivery. And then tier 1 was bad choices, and tier 2 was really bad choices. So we have the ability to balance our budget, but there's no easy choices. I think that people will feel it. It's not going to. We're going to notice the consequences. But hopefully, and maybe I'm a little hopeful, putting any type of trust, I guess, in Washington. The House passed a bill that would actually have made us whole. Where the first CARES Act doesn't allow us to backfill the economic devastation that the coronavirus has caused. It instead gives us a pot of money to use to directly provide services that are directly related to the coronavirus. So that money allows us to give, for example, free rides on a bus on Saturdays during the stay-in orders for people who are out of work so they can get to the grocery store and back. But we can't use that to kind of backfill our budget problems. So hopefully the Senate over in DC will come out with a counter bill, a counter offer, and try to help us out, because at the city level we don't print money. This is a national disaster, and we have the ability to balance our budget, but it's going to be a really steep cuts. It's going to be with stuff that I think a lot of people won't be happy with making, but you have a responsibility to make those cuts. Now, when it comes to furloughs and layoffs, we actually didn't discuss layoffs at the budget retreat. They did discuss furloughs, and some of those furloughs are actually for programs that might not come back online this year for health reasons, and also for budget reasons. So if you're someone who were furloughed because in March we thought we were going to run these summer camps, so we thought we were going to run this program, and now we might not run the program because there might not be a safe way to do it, and also there's a cost savings moving forward, then that furlough will probably stay. There also was discussion about strategic furloughs, where people who wanted days off and wouldn't get paid for that day, but they also wouldn't be penalized. Are there ways that we can utilize strategic furloughs for people who, let's say, want to go on vacation, don't have those vacation days? They're not worried if they're not getting paid that day. Could they go do that? So we are having some of these discussions about ways to save money while moving forward. Do we have positions that haven't been filled and the department's still doing okay? They could really use that position, but for the next year, they can handle not having that position hired. Is there a cost savings there? Can we utilize that money? That's the type of decisions we're making. We got $150,000 we used to plant trees throughout the city, to beautify our city. That's a discussion item where we probably won't do that for the next 2 years. That's one of those things that we're looking at cutting. One of the things I think I'm getting a lot of calls on is, for example, grass mowing. Where is there a savings if we don't mow the grass as often as we do now? So those are the type of discussions we're having at the city level. It's not pretty. Like, there's just no money tree that we can go to and kind of save ourselves from making tough decisions. These got to be really tough decisions coming forward. Sadly, we've done it before. We've been in recessions before, and our staff, because they are professionals, because they are really experienced people, they are helping us through this and being able to utilize some of that institutional knowledge about this is what we did in 2010, and this is how we handled things in 2008. So I think moving forward, it's going to be tough, but we're trying to provide the best services we can while being responsible and balancing the budget and also doing right by our employees, which is why when we did that first round of layoffs, we worked really hard to not layoffs, excuse me, furloughs. We worked really hard to ensure that everyone would have a paycheck during that time.
Okay, 316-491-5787. That's the number to give us a call here. Carol, I know you've been waiting. Thank you for waiting. Carol, you have a question about cutting, but I think this is a different kind of cutting. Carol, you're on the show.
Hi, Carol.
Yes, I am. I was wanting to know, are we still mandated by the governor to do what she said for our opening, or do we go by what the city and the county is saying now?
Carol, what are you talking about
Yeah,
here?
Carol, what's your business, just so I know?
I'm a hairdresser.
Oh, okay.
And we were mandated by the governor to do certain things. Mm-hmm. And now that you're doing reopenings in the city and the county, does that change that, or do we have to stand with that mandate?
That's a good question. Okay, so again, what was going on in Topeka, and because I'm a former legislator, I have some insight on how they were trying to craft the safest way to move forward. If you're a hairdresser and you fall under the Board of Cosmetology or the barber board, they actually came together and figured out, okay, what is the best practices moving forward to keeping people safe, and that's one of the reasons why they were one of. If you saw the last rounds or the 1.5 plan on reopening, a lot of it was these professional services that are licensed and are actually have professionals within that licensing body who could come in and help design these practices moving forward to keep people safe. So my understanding is that the governor order is no longer in effect, and that falls to the county. However, if you're someone like a hairdresser, I would reach out to the Board of Cosmetology and ask them what the best practices are moving forward. I think they would be a much better resource to answer a question like that than I would, because it's not so much about like, what do you have to do, or because I know that you're not asking like, what can I get away with? I think you're asking, what can I do by keeping my customers safe and still staying within the spirit of these orders, or if these orders exist or not. Right now, these orders don't exist, but your profession might still have these best practices on the list. So definitely reach out to the Board of Cosmetology. I think the Ad Astra plan, the governor's plan, that website's still up, and it's still recommended to follow these best practices to keep people safe, even if you're not mandated to do it, because you really, not only do you not, I'm sure, want to get your customers sick and make sure that everyone stays safe, but also there's an economic point to that, where if someone is to get sick while they're at, God forbid, at your shop or at another hair salon, that will have a ripple effect, because the county and our health department will figure out where that cluster is or where it came from, and you don't want people to assume that doing this one activity is unsafe. So we are encouraging people to still take these precautions, because even if they're not mandated, and like I said, once you reach out to your professional board, I think you'll get a better answer. But you still want to take these precautions because as we open up the economy, we want to keep people safe, but we also don't want people to get sick, and then that profession gets a bad rap because someone got sick going swimming or going to a bar or going doing this or that, and we trace it back to activity.
And Carol, by chance, are you still on the line? If you're not, I think we have.
Yes,
it.
I am.
As the mayor knows, I believe each county is now not bound by exactly the governor's plan. The governor's plan is a recommendation at this point. What county are you in, Carol? Because that can make a difference. Harvey County, in Newton, if you're going to be over in Butler County for El Dorado, but what county are you in?
I should have asked that, yeah. That's a big difference. Are you in Cedric County?
Yeah. I'm in Sedgwick County. We were just discussing this at work today, if that was still a mandate, because part of her mandate says she's the only one that can change it.
Right. So.
And I tried to contact the State Board of Cosmetology, but you can't get you can't even leave a message anymore because they're so full. Okay. And they only have one line set up for this.
Okay.
So,
well, that's disheartening. So my advice moving forward too is you want to follow the best practices, and it sounds like you probably already know what those are. It sounds like they already communicated those to you. Like I said, the goal is to keep people safe. There's an economic benefit to not, making an industry seem like it's unsafe. And also, I think most people love their customers. I would follow the recommendations as they were. And the county commission did have the authority to reinstate some of these, and although they didn't, they stopped just short of reinstating the governor's orders. They had asked for a plan, and instead they said it's a recommendation. So they did vote that we recommend people still continue forward with these precautions. I think that that's probably what I would do if I was in your situation, is follow the recommendations policy-wise that was developed by healthcare professionals and really professionals in the industry. And hopefully you can get in touch with someone over at the Cosmetology Board. Like I said, they're going to be the experts. They were likely at the table when this policy was being discussed, because good policymakers, they bring experts at the table when they create these type of policies.
All right, call the Mayor of Wichita. Thank you for that answer. 316-491-5787. You can catch us on Facebook. I know many of you do, and you go back and watch the show again and listen and get information that way. But Michael, you're on the show. Thank you for calling. Michael, what is your question?
Hi, Michael.
Yes, sir. Good evening, sir. Mayor Whipple, how are you, sir?
I'm doing well, sir. How about yourself?
All right. Mayor Whipple, I have a question for you, sir. Since Wichita is the air capital of the world, how come there is no public transportation to and from the airport for low income, for residents, non-residents of Wichita? There was an experience that I had, sir, where I had to walk, honestly, in 110-degree weather from the airport out to Ridge Road in front of the IHOP there just to catch, a bus to get into the interior of Wichita. So I was just wondering, how come the city isn't taking advantage of that, sir?
So that's a really good question. I mean, it gets not just to the airport, but also to public transit. Right now, we do have privatized shuttles that will bring you downtown, if you're going to one of the hotels downtown. It sounds like in your situation, you were looking to get to the airport and get access to public transportation, which would be a really long walk because the airport's set backwards. That's something we need to look into. Our entire public transit system is something that we can do a lot of improvement on, particularly out west, particularly out where the airport is. I think that we've seen some cuts to some of those routes as less people travel when on the buses out there, and we've had some pilot programs that I think would help out in a situation like this, where they're rideshare type programs, almost like an Uber, where you call ahead or use your app and you're able to say, hey, I'm going to be at this location, and I need to go to that location, and they actually bring a small bus on a scheduled route with you and other people who might make those type of appointments. So that's something that was a pilot program that we started a couple months ago. I haven't followed up on it because with the whole COVID and everything, we're not sure if the data from the pilot's going to be what it should be, because people are staying in instead of utilizing public transit. But that type of stuff is innovative, and it has showed really effective in other communities. And if we can continue, then someone like yourself could actually set up a time where our public transit, one of these buses, can swing by, pick you up, and bring you to either a downtown location or another location. So as we move forward and start looking into transportation, that's something I'm going to be pushing, is some of these more innovative ways to get the most bang for our buck utilizing our current system, until we're in a position where we can invest in even more buses and even more bus drivers, where if we had more buses on the road, we can cut down on some of this time that takes you to get from point A to point B. I worked at Wichita State last semester, and while I was running for mayor, I actually looked up what it would take for me to take the bus, and wanted to do that at one point just to have that experience, be able to talk about public transit a little more clear. And it was well over an hour that it would have took me to get from my South Wichita house over to Wichita State's campus, and it's really a 15-minute drive. So there's lots of work we could do when it comes to our public transit. I will say we have a really good director over in that department who is forward-thinking, and when things get, I think, a little bit back to normal, and when we start to see some more stability in our budget, that's something that we should be hopefully looking at and investing in.
Okay, so again, Mike Tan, if you're listening, give us a call. Maybe.
Hey, Mike, are you on the line? Or
speak of that a little bit again. We do have another caller, though.
Okay.
Different subject, 316-491-5787. And what do we have? A dozen or is it 13 other cities within Sedgwick County here, I believe.
Quite a bit.
And I know each of them have nursing homes, and that question has come up a lot. Carolyn, welcome to the show. What is your question for the mayor?
Hey, Carolyn, I'm going to fix my earpiece, so don't mind me. But yes, go ahead.
Okay, yes. My name is Carolyn. I have an elderly parent in a nursing home. She's been there since the beginning of March. My father passed away in February, so 1 week after he passed away, she was locked in. She's not been able to get out, and they're telling them, I thought that originally that they were going to test the nursing home patients and then start easing restrictions, but the nursing home is saying that's not a mandate now. And I'm also a nurse. I work in one of the local hospitals, and our facility is allowing people to at least come in and visit just one family member for a patient. I was just wondering when some of those restrictions would ease.
So that's a really good question, and one of I think the worst, there's a lot of bad that comes with this crisis. One of the worst parts, at least to me, is reading the stories of loved ones who are in nursing homes who, for their own safety, have to be isolated from their children. And I know that my kids, we're not going to see grandma. Like, we're just starting to ease back towards that because to keep her safe. So when you talk about these restrictions, I actually think these are going to be more industry specific than these more global restrictions from either that happened in the past from the city level, or the county level or the state level. So these restrictions actually might come down from either whoever is accrediting the nursing home or whoever is the kind of the overarching company that owns the nursing home. So I would check with them. I don't think these restrictions are coming down from the governor or from the county, and if they are, they're likely not in effect at this point. But a lot of, particularly, really sadly, the death count in Sedgwick County, I think all but 3 of the 21 have actually come from clusters in nursing homes. So nursing homes are very much cautious. They're on lockdown right now to make sure that they're protecting those who live there, and so it might be that these are the policies of the nursing home or the organization that owns the nursing home. So I would double check to see where that policy is coming from, and also what are the exceptions. Keep in mind, we actually have a lot more testing now, so there might be some ways to move forward where you get a test or you pass a test, and you said your mother was also going to get tested. There might be some opportunities now that weren't there a month ago, back when tests were really scarce.
All right, Carolyn, that's a good question. I happen to have a family member myself that works in an assisted living facility. Lockdown, perhaps not the right term, but they are certainly as cautious as they can be, and you'll need to check with your individual counties as well to check with either commissioners or check with the local board of health in your county to find out what are the rules going in, or we've seen some of the most touching moments of people going up to the windows and singing to loved ones. That's been one of those real positives to come out of all this, hasn't it?
Yeah, and that's the interesting thing is, we've seen a lot of bad with this, but also there are a lot of positive moments, and I think that there's not, on my Facebook feed, on my social media, lately there's not a lot of positive, but one of them is, I think we saw the same story where people going up and seeing their mother, grandmother, like my kids who look that age, going up and touching the windows and so on. And we all just want to get back to normal, but we want to do it safely. And I think that the high-risk population that nursing homes attend to, they are cautious, and that's good. We want people to be safe. We want our loved ones who are in nursing homes to remain safe. So, but hopefully, you'll get some more information by contacting and finding out where those regulations are coming from.
316-491-5787. We've got time for one more quick call, but I will say this. One of the questions we had up on Facebook tonight, and I'll have you kind of point directly more to this question, that was, you talked about getting back to some things, holding back on other things, but will you continue your town hall meetings? And if so, when? So the question is I guess when, basically.
I would love to. I got to tell you, I love getting out and talking to people. And my background, it's called a qualitative researcher, right? Where you actually get stories and experiences, and then I'm able to use that for crafting policy. It's how I collect data. Before this, we had a lot of really good stuff planned. One of them was I was going out to every district, and within, I think, 2-week period, we would have blitzed every district and had town halls in every single district. And sadly, I was only able to do one of them because we didn't want to gather people into a room where they could possibly get sick. My goal is to start that back up as soon as possible. I replaced that a little bit with online, being able to go Facebook Live and to do interaction that way and to take questions. And there have been some talks about utilizing Zoom meetings, trying to do maybe telephone town halls. It's not the same. I really like that interaction with people, and we bring notepads so people can write down their ideas if they're too shy to say their ideas out loud in front of everyone. So my goal is to look at all that and have that bottom-up perspective when it comes to policy making. What is the community thinking and what do they want? I rather make policy based off that than kind of top down, where it's being handed down by academics or experts.
All right, thank you very much, Mayor. I guess we're out of time for
callers. We're out of time?
But
I'm a little long-winded, so.
No, that's fine. It is the Call the Mayor show, and you answer the questions. So with the minute and 30 that we have remaining here, what will it be like a month from now if you've got a crystal ball? What's the feel among and amongst, not just county, but maybe the city leaders about how's this reopening going to be going? So
hopefully, if the next month works out as well as last month, right, where our planning has been strategic, it's been conservative, and really it's been supported by the community. People in Wichita have been doing the best they can to stay healthy, given the facts, given the information. Hopefully next month we can start taking that to the next level as far as opening things up. What we're really waiting on, and the virus will stick around, and we'll likely see a bump as people start traveling a bit, but we're also buying time. We want our medical community to be able to come up with really good treatment, and we're likely going to have really good treatment. Some of these antiviral medications, some of this kind of cocktail they're going to come up with, we'll likely have that before we have any type of vaccine. So the goal is to buy the medical community time, make sure that we have really good treatment for this, and as a city to start slowly opening up the safest way possible until then.
All right, I think perhaps our Sedgwick County Health Director said it best at one point. Got to understand the virus kind of in charge for now. We do what we can.
And that's the thing. People say, hey, you're moving the goalpost, or you told us this and this is what happened. I just want to remind people this is about the virus. I wish we could legislate it away, but it's what's driving the ship right now.
Well,
thanks
Greg.
for
joining us. You bet. We'll see you next time.